Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, good evening everyone. I'm Dr. Kaushik. I'm a consultant neurologist working in Kumaran Medical Center, Coimbature in Tamil Nadu. My field of interest is predominantly about an epilepsy and stroke. Here I'm going to share my few views and public awareness about epilepsy.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Yeah, in medical terminology, there are two kinds of variants are there. One is an seizure, another is an epilepsy syndrome. What is seizure? What is epilepsy? If there is an incident of an electrical imbalance in the brain, like an electrical shock-like sensation within the brain, multiple neurons get triggered and it produces an involuntary movement of one upper limb and one lower limb, or it can be on one side or it can be on both sides bilaterally. It can produce a seizure. If I had a patient had an one episode, we call it as a seizure. If the patient had an multiple episodes along with some other neurological deficit, we call it as an epilepsy syndrome. That we want to differentiate between whether the seizure is treatable or not treatable, whether it is an harmful, is an alarming. We want to check with an multiple episodes and history. We want to make it very clear.
What are the different types of seizures and do they affect people differently?
Yeah, definitely. If a similar kind of two subjects getting the same kind of seizure, both are not same. It may be a variable. Some patients may get recovered very soon. Some may get delayed. Some doesn't may require any treatment. Some may go for an ICU ventilator like that. So, what is a seizure? What kind of seizures are there? Then that we'll get into it. First, it's a generalized tonic-clonic seizure. Second one is an complex partial seizures. If you have involuntary movement involving both upper limb and lower limb, then you are having a loss of consciousness. It's called as a generalized tonic-clonic seizure. If you have an involvement of one upper limb and one lower limb, then within loss of consciousness, it's called a complex partial seizure. If it is a simple jerky movements involving one upper limb alone without any loss of consciousness, it's called simple partial seizures. Then there are a few that is called idiopathic seizures that we want to look on the history and symptomology of the symptoms. Then only we can come into a conclusion.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No, epilepsy is usually is not a non-cause. 60 to 70% of epilepsy is due to because of some cause in the brain. 30% of epilepsy may be related to a non-cause. So it can cause an idiopathic seizures. What are the things we want to first initially look for is what are the seizure mimics? So if the patient is having an hypoglycemia, low blood sugar, if the patient is having a low sodium, the patient is having a low albumin, the patient is having a low calcium, those patients also have through a seizure. Those are not called, they are just a treatable dysautonomia. They are called seizure mimics. Some patients will have a complex partial seizure. Usually for complex partial seizure, we want to look for imaging of the brain. So it may be due to any lesion in the brain or it may be any blood clot or any hemorrhage in the brain that may trigger a seizure like a complex partial seizure. In case of a generalized tonic-clonic seizure, it's predominantly due to any lesion in the brain or it can be due to an idiopathic cause. So depending upon the similarity of the seizure, we can come into what kind of seizure it is, whether it's treatable or non-treatable. Then we can come into a conclusion that whether it's harmful or not.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, definitely. If the patient is having a seizure, That patient should have an seizure diary. What are the drugs they are following? Previously, what drugs they have followed? Whether any drugs have stopped, any drugs have altered, is there any drug interaction, is there any adverse effect for the drugs? They want to monitor in that seizure diary. If the patient is having any app for it, they can load it in the app. They can use it for the personal use. They should share with the caregiver also. For the caregivers, they should notice certain symptoms. The patient may have an lip smacking movement. Is there any hand twitching movement, cloth picking like of movement? Then is there any facial grimacing like of movement? These are called aura symptoms. So once the caregiver notice these kind of symptoms, they may come to the conclusion that next this patient is going to get seizure. So they should make the environment very clean without any sharp objects. Ask the patient to lie down or lie down on the floor or bed without any sharp objects. There should not be any harmful environment around it. If the patient is in traveling or it's on the road, he should stop the car and be on the roadside, and it should be very safe. These are the precautions caregiver can notice these kind of symptoms.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, definitely. The stigma is predominantly very common with an young female child who got an epilepsy. They will get a stigma that the girl is not fit for anything. She can't marry. She can't do anything. The drug will produce lot of side effects. Lot of adverse effects will be there. Childbearing is not possible. Those kind of stigmas are very common in our society. That is all absolutely wrong. At present, we having a multiple kind of drugs we can use for a multiple group of patients. They can do very more wonders without any complications. Then next stigma is if the patient is having a seizure, he want to continue the drug for the lifelong period, so he can never stop the drug. It's not like that. Few patients or multiple patients, we are stop the drug and on a 2 or 3 years period, they are very well controlled with anti-epileptic drugs. Then few patients we are going for an epilepsy surgeries also. After epilepsy surgeries, we are able to taper the dosages of multiple drug therapy and can be a monotherapy. Then he can also stop the medicines in between. Then
Okay,
another stigma is predominantly on the while taking the precaution for the patient. If the patient is throwing a seizure, or you want to give any iron objects in the hand to control the seizure, it doesn't mean that. If any seizure can occur, it can spontaneously stop in 2 to 3 minutes, 3 minutes of time. That is, if you give any iron objects or key like that in the hand, it may make the patient to harm himself. It is not a good sign.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, as I previously mentioned, caregivers should be aware of what are the drugs patient is taking, what are the drugs the patient is going to be in allergic, what are the drugs is going to get the adverse effect. These are the things they want to be very cautious. Then they want to carry the drug each and every day. They want to keep it in the packet or in the pill box. They should maintain the temperature of the drug. They should not be exposed the drug to the sunlight too much, so it may reduce the efficacy of the drug. Then they should take the drug at appropriate time. And appropriate time they should have the food in appropriate time. Then they should have some workout in between also.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, as I previously mentioned, if the patient is throwing seizure, there are multiple precautions we want to take. First thing is secure the patient. We want to remove all the sharp objects in the surrounding of the patient. Then, because if there are any sharp furnitures or any sharp objects, he may throw an involuntary movement and hit on it and he harm himself. then don't try to restrain the patient. If you are trying to restrain the patient, he may get any fractures, he may broke his leg, he may broke his arm also. Don't try to put anything in patient's mouth. If there is a clenching of tongue, if you have any handkerchief, roll the handkerchief and try to put it inside the mouth. Even if you are not able to do, don't do anything. Just wait for 2 minutes. Put the patient in a left lateral position. It will more than sufficient. It will avoid the aspiration as the saliva to roll around the left side of the mouth. It will prevent the aspiration and suffocation. If you are trying to put something in the mouth, it can produce suffocation. It may injure the patient. If the patient is wearing any tie or any collar buttons, remove the collar button. Make the patient to breathe freely. Don't surround the patient completely and make him more suffocate. Leave more space very freely. So make the environment very clean. Give more air. Remove all the tying substance around the neck, then put the patient in a very safe position. If the patient is throwing shisha on the middle of the road, try to pull the patient toward the platform and secure him there. If the patient is on the stairs, ask the patient to put him on the lie down or remove from the elevator or escalator and from the stairs and put it in a lying floor. Then, if the patient is in the swimming pool, he may risk of an aspiration. Those patients, you want to immediately rush the patient to the ambulance to the hospital. Then, what are the other things we want to think is if the patient is throwing continuously seizure for an two or more episodes in a 30 minutes time, those patients should be immediately rushed to the hospital. If the patient is having any epilepsy syndrome, those patients also should be immediately rushed to the hospital. So when you can leave the patient as it is after completion of seizure, the patient should get his consciousness. It may take around 10 to 15 minutes. Once the patient is able to self-realize and he is recover all the consciousness, then only you can leave the epilepsy patient alone. Till that, some caretaker should be along with the epilepsy patient till he
Thank you.
regains the consciousness.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.